round object netted with something. You have a lot of surface area between that little grape-looking thing and the net of capillaries around it. Does that make sense? Mm-hmm. And the grape, which can look like this, can have that netting of capillaries all the way around and three-dimensional. Good? In emphysema, the walls of the alveoli are destroyed. So what we end up having, instead of an alveolus that looks like this, we get an alveolus that's much bigger, and the borders are not quite there. And when we look at two alveoli or several alveoli together, instead of having this kind of action, we get this kind of action. So an alveolar sac should have a ton of individual alveoli. But in emphysema, what we get is we get an alveolar sac that is basically one big, giant, lumpy alveoli, which means we still have a netting of capillary around it, but that netting of capillary is only around there. It can't get inside because it can't get all the way around all of the individual alveoli. Does that make sense? So we have less surface area that the alveoli and the blood vessels are coming into contact with each other. Good? Okay, because we have one big lumpy alveoli instead of a bunch of small ones, and because the lungs lose that natural recoil, which is the #1 problem in emphysema, we end up with these large alveoli that are trapping air. We have trapped air. Does that make sense? In addition to that, what was the first thing I talked about in it?
Elastic.
Before the elastin, I said this.
The smoke down the airway,
Which is doing what?
irritating it,
Which
inflaming it.
it's inflaming it. So in addition to that, we have narrowing of the little airway tubes, the bronchi and the bronchioles, and there's a buildup of mucus in there. And so what we end up getting is we end up getting trapped air in the alveoli. We've lost the recoil, so we've lost that positive pressure that the lungs would be putting into the mix. We have trapped air, and it can't get out because we've got mucus and collapsing of the bronchioles in here as well. Does that make sense? It's complex. There's a whole bunch of complex issues that are going on at once in here. So we need to do a bunch of things. We need this person to get rid of more air. Okay, so what's one of the symptoms that we see? What's one of the signs that we see in an emphysema patient? They become barrel-chested. And they're becoming barrel-chested, why?
Because of air trapping?
Yeah, because they have more air in their chest cavity than normal, and they start to have that air trapping that's there that causes them to be barrel-chested. So we need them, A, to get rid of more air. They have to get rid of more air because they're holding on to more air than most people. Good? In addition to that, we also have to make sure that the air can get out of these bronchioles that are full of mucus and collapsing on themselves because they're weak and they've been inflamed. Good? Two separate issues. And in addition to that, not only do we have to get more air out of here, but we have to make sure that the air that we do get there can have a better VQ matching. Do you remember VQ matching? Ventilation perfusion matching, meaning we put the air where the blood vessels are and try to get better oxygenated air to where those blood vessels are. Does that make sense? Okay, so pursed lip breathing helps with all of these things. Pursed lip breathing helps with all of these things. And in some patients, they naturally do it, and in some patients, they are taught to do it. And there's actually a process of teaching true pursed lip breathing versus just the physiologic pursed lip breathing that they naturally do. But the goal of pursed lip breathing is twofold. The goal of pursed lip breathing is to slow their exhalations down and increase the pressure at which they're exhaling. And that helps to retrain their diaphragm. So in emphysema, what kind of breathing do they often have? What's helping them to breathe?
Their
Muscles.
intercostal muscles.
Accessory muscles. Accessory muscles.
Accessory muscles, yes. Pursed lip breathing is actually going to retrain them and help them to use more of their diaphragm than their accessory muscles. It forces more diaphragmatic breathing. In the process of doing that, it's going to do two things. It's going to slow the exhalation and increase the back pressure, which will take these little bronchioles and expand them, which is what Chris said. Yes? And it'll expand them. Then what it's going to do is it's going to extend their exhalation time. It's going to take longer for them to exhale. They're going to use more diaphragm, and they're actually going to start using their more of their intercostals as well, so that they can take this and use muscles to reduce their dead air space. Push more air out at the end.
If we're creating back pressure to expand the bronchioles,
Yes.
are we also creating back pressure to push that air against the walls
Yes.
of the alveoli
Yes.
to have more contact with the capillaries?
Yes. All of that's happening in pursed lip breathing. That's correct. Good? So the pursed lip breathing is going to help to expand those bronchioles. It's going to help to increase the pressure at which they're exhaling, which is going to cause more air to come out so that they get more of their dead air space out, which they're still not going to match what a normal person would have. Right? You relax and you've gotten rid of all your air down to your dead air space. They use muscles and still don't get down to the same dead air space volume that you have. Does that make sense? But they're trying. And they're trying to get more of their diaphragm involved in that. Good? Okay, questions on pursed lip breathing?
So pursed lip breathing does increase pressure.
It increases back pressure, and it ends with more muscular involvement to get rid of more airspace at the end, to account for the fact that the lungs don't recoil on their own.
So that back pressure, threefold. One, increases the diameter of the bronchioles.
Yes.
Two, increases the pressure against the alveoli and the capillary. And three, helps to expel more air.
Correct. To compensate for the lack of recoil that their lungs no longer have.
So it's increasing perfusion.
Which is exactly the point. The
Yeah.
end point is it's not increasing, well, it does increase perfusion, but it's to increase VQ matching.
Can you say that again?
So, do you remember back in anatomy and physiology, you know that when you breathe in, when your oxygen's coming in,
Mhm.
your blood vessels in a part of your lungs that have a lack of oxygen
Mhm.
will constrict,
Oh.
so that blood doesn't go there. Like if you have a pneumonia,
Mhm.
your breathing that comes in will be diverted away from that pneumonia area, because the whole point of the alveolar blood barrier is to get oxygen in and carbon dioxide out, right? But if you have a pneumonia there, you can't get that exchange, so it's inefficient to send air there.
Okay.
So it sends it someplace else. That's the ventilation perfusion matching. This improves that because it makes us have better oxygenation at the site where the capillaries are, which happens to be throughout the entire lung wall.
Okay.
Does the word perfusion relate to the lungs at all?
No, it's related to
Capillaries.
the capillary movement of oxygen. Good?
So here we're talking about
Okay,
diffusion.
so now let's go to the question, because the question was tricky and it shouldn't have been. I accepted both of the answers, but I want to make sure that you understand what the question is asking. The question says, you have arrived at a nursing home to attend a patient experiencing an emphysemic attack. You notice that she is using accessory muscles, sitting in a tripod position and exhaling with pursed lips. The reason for pursed lips is because in emphysema, and I understand now that it's confusing, but the answers there were the lung loses their natural recoil,
It's
the
a true
diaphragm has
statement.
lost its ability to contract and force air out of the lungs, the patient uses the pursed lips to expel mucus brought up through breathing, and pursed lips are used to slow exhalation, allowing a slightly more positive pressure in the lungs to help keep the alveoli open. So let's eliminate two of those really fast. The diaphragm has lost its ability to contract and force air out of the lungs. Nothing's happened to the diaphragm. The diaphragm works just fine. The patient uses the pursed lips to expel mucus brought up through breathing.
No,
They're rarely productive. In fact, when they start getting productive, you start thinking of
bronchitis.
you start thinking of pneumonias or other infections. So they're very rarely productive. So that leaves it to the lungs lose their natural recoil,
That's
which is
correct.
a true statement. And the pursed lips are used to slow exhalation, allowing slightly more positive pressure in the lungs to help keep the alveoli open, which is also a true statement. Both of those statements are true statements. But only one answers the question. And the question, what's the question asking?
What's pursed lips mean?
Will you repeat the question?
Yes.
Just the last part of it.
The reason for pursed lips is because in emphysema, what's the question asking?
What happens in emphysema?
What happens in emphysema? It's not asking, what does pursed lip breathing do? It's asking, what is happening in emphysema that leads them to needing to do pursed lip breathing? It's a way to,
Shitty question.
I didn't say there was not confusion.
It's a discussion.
That's Matthew's question for Matt.
But the very first thing I told you guys is that you have to take a look. I didn't mean to have it as a confusing question. But you do have to pay attention to what the question is actually asking. Because often you'll have a couple of answers that are correct answers, but not necessarily correct for what the question's asking. And this question is asking, what's happening in emphysema that leads somebody to need to do pursed lip breathing? Not, what does an emphysemic do when pursed lip breathing? Does that make sense? So I accepted both of them on both part ones and part twos for this, but do understand the question was asking about emphysema, and in the end, I really don't care. What I care about is you understand what we just talked about.
But we've got a great discussion about it,
That feels like
and now we
semantics,
know.
though.
Now we only have 70 more questions to
It
go.
doesn't change the fact that you're gonna be asked questions and you have to know what the question is asking. You have to be able to know what the question is asking. I don't mean to send you tricky questions. I know this was tricky. I didn't mean to send you a tricky question. But you'll get a tricky
Let's
question.
talk about Mount Everest now.
And you do need to make sure you know what the question's actually asking about,
Whatever, one Mount Everest.
right? One question asks about emphysema and what's happening in emphysema. And one question would be asking about in pursed lip breathing, what happens in the lungs during that pursed lip breathing, right? So, I don't care, during emphysema, what's happening in emphysema? What is the primary concern with us, with our emphysema patients?
The lungs don't have their recoil.
The lungs don't have the recoil, and therefore what happens to air in the alveoli?
It's trapped.
It gets trapped. What do they do to try to compensate for that?
Pursed lip breathing.
And what happens in pursed lip breathing when they do that?
Creates a back pressure
That does what?
that inflates the alveoli and inflates the bronchioles.
And
And
slows down exhalation
creates more
Raises
pressure
the
against the
diaphragm more out.
alveoli too. What was
and
that?
it allows you to get more air out in the air
Last-
because you're pushing against pressure. Make sense?
I think when you're bagging somebody that's an emphysema patient,
Let's
why we
go.
don't hyperventilate? Start doing this, they start stacking air, you're gonna blow a lung out.
Yeah, when we talk about breathing rates, right, we're pretty adamant that you should be breathing in the 8 to 10 range for most people, right? You'd be perfectly okay breathing in the 4 to 6 range for an emphysema patient.
Long, extended
You
exhalations.
push on the chest form.
They do it.
Really?
Yep, they do it.
Okay, questions? Are you good there?